building. Hope all of you welcome at the Department of Research. Please start.
Bismillahirrahmanirrahim. Assalamu alaikum, respected teachers, my colleagues. This is Muhammad Rahman Amjad Beg, under the registration number is 2020 VA46. Today, my topic of presentation is the comparative study of external skeletal fixation and splinting for tibio-tarsus fracture in pigeon. My supervisory committee is my supervisor is Dr. Sadaf Aslam, and my major member is Dr. Hamad bin Rashid. My minor member is Professor Dr. Anila Zamir Durrani. Next. This is the outline which we covered today. This is the introduction, objectives, hypothesis, materials and methods, parameters, results, discussion and conclusion. Introduction. There are the different type of birds. Some birds are the swimming birds, some birds are used for the flying birds, some are the non-flying birds. We have research on the flying birds which include the pigeon. Pigeon is from the family Columbidae and species is Columba livia. There are approximately 313 breeds of the pigeons are present all over the world, and they vary in size from the sparrow to the fowl size. All the pigeons, they are originated from the pigeon rock dove. The purpose, the people rear this bird for the ornamental purpose, for the gaming birds, like for the racing birds, and also for the meat purpose, because it can be vary from the small size sparrow to the fowl size. Next. There are a lot of injuries which can affect the bird, like there are a lot of injuries due to the mid-air collisions, fight with other birds, predators attack, encounter with traps. They can cause a fracture in birds.
Material method, result and discussion.
Material methods, results and discussion से start करें.
Okay, sure.
Let us see. First, show your face.
अपना कैमरा भी ऑन करें.
Introduce yourself. रहमान अपना कैमरा ऑन करे और अपने आप को इंट्रोड्यूस करवाएं पहले. We want to see your face first.
Bismillahirrahmanirrahim. Assalamu alaikum to my respected teachers, dear colleagues. Today my topic of presentation is the comparative study of tibio-tarsus fracture. Hello.
जी हम सुन रहे हैं आप.
Presentation show हो रही है मेरी?
हाँ हो रही है.
Okay. The comparative study of external skeletal fixation and splinting for tibio-tarsus fracture in pigeon. Now we are moving toward the materials and methods. There are the 6 birds in each group. We have 2 groups. One birds we treated with the ESF, which is external skeletal fixation, and other birds which include the 6 birds which we treated with the splinting technique. So this is the basic anatomy of the bird. We have work on the tibio-tarsus bone. In the birds, the tibia and the tarsal bone are fused. So we had research on the tibio-tarsus bone, and this is the bone. Maybe my cursor is clearing to you. This is the bone, tibio-tarsus bone. There are a lot of forces which are depends upon which cause the fracture to the long bones, along with the shearing force, bending force, torsional force, axial compression. These forces can cause the fracture in birds. So we have more detail of the tibio-tarsus bone with respect to the caudal view and the lateral view. This is the caudal view. This is the lateral side through which we pass the pin in the birds for the tibio-tarsus fracture repair. This is the fibula bone, which is very small bone. You can see this is the body of fibula, and this is the head of the fibula on the next caudal view. You can see. different forces cause different fractures in the birds. For the long bone fractures, and the fracture classification also vary from it's depend upon the different factors, like it's the communicated, non-communicated, open, closed fracture, type of the fracture, site of the fracture. We can classify all fractures on the basis of these parameters. So these are the muscular anatomy. This is basically, next slide. This is the muscular anatomy. This is the gastrocnemius muscle, which having the 3 heads, then the extensor longus digitorum, and extensor brevis, and flexor perforatus.
प्लीज अपनी डिजाइन पे जाएं।
Hello.
डिजाइन पे जाना है।
मटेरियल एंड मेथड पे जाएं।
इसी तरह से यूज इन स्लाइड।
Okay, sure, sir. This is the preparation of. Okay, this is the technique. This is a surgical approach to the cases. Surgical approach, we use the anesthesia, the alpha 2 agonist with the dissociative anesthesia with the combination, and after the anesthesia we just pluck the feathers as minimum as possible, because it lose the heat from the body surface of the bird. After plucking the feather, we just rinse with the chlorhexidine solution, and just to rinse the and apply the linear scrubbing. After the scrubbing, this is the first pin which we pass. If maybe please show the first instruments. These are the basic instruments through which we pass the pins in the birds. These are the very few instruments. There are the 3 instruments which we used during the research: the Jacob's chuck, the wire plier, and the pin cutter. You can see the first pin which we pass from the lateral side on the distal fragment of the fracture. Next, so in the next slide you will see there is the another splints which we pass the pin from the lateral side to the medial side, but we hold the bone from the hands, because in the bones are very brittle and thin. If we hold the bones with the clamp, it may break from the other parts also. So after passing the second pin into the fracture site, we apply the splint joints. At the splint joints, we just cover and fix with the orthopedic wire. The next, this is the final model. After the fixation of the fracture, we cover all the fracture with the orthopedic wire, just to make a joint which fix the fracture. And these are the of course the lightweight also. After fixing the fracture, we apply the epoxy putty on each joint, just to make fix the fracture, just to make fix the splints with bars, external bars. This is the results. The first is the before the fracture. This is the tibiotarsus fracture. A fracture repaired by the ESF technique. After repairing this fracture, the next slide, fracture repaired by the ESF, and this is the callus formation. There is a relative stability. The stability is just, we can say there is a absolute stability, relative stability, and the as the fracture is more stable or more rigid to the bone, I mean both fracture fragment are equal or oppose the other fragment with compacted form, the callus will be shorter. If the bone is moving or the stability, like the rigid stability not occur, the callus will be larger. In the birds, they have a major problem. If we have a big callus in the specifically tibiotarsus bone, there will be an inflammation. Due to the inflammation, birds show the sign of the lameness, which we are going to see in the next case, which is basically about the splinting. Next, please. So in the birds, this is again for the splinting. We just give the first layer of the bandage, then cover with the cotton, and the third, which we apply the tongue depressor. We use the tongue depressor on the after the cotton bandage on the fracture side and fix the fracture. After fixing the fracture, you can see there is a X-ray which you can see the fracture line and the fracture is fixed. But after 41 days, when we remove the splints from the fracture, there will be there was a bigger callus formation. It makes more inflammation at the fracture site, which cause the inflammation and the lameness, because we have parameters also. If we are talking about the lameness, in the group A, the blue line show the group A, which is we treated with the ESF technique. In the group A, all birds are no showing lameness, but in the group B, all birds showing lameness except one. These are the graph, and you can see the inflammation, the sign of the inflammation at the day 1. Of course, there is a fresh fracture, so all the birds from the ESF group and for the splinting group show the sign of the lameness, and the lameness is the inflammation is decreasing from the day wise. You can see at the 42 day there is no inflammation with in the group which we treated with the ESF. If we are talking about the callus formation at the day 41, there is a minimal callus started. Of course, there is on the day 1 there is a no callus. At the day increasing, the callus formation also increasing comparatively better in ESF than splinting technique. Discussion. In the group A, only one bird show the severe lameness. While in the group B, there are all birds show the severe lameness on the day 1. Similar findings are also recorded by the Keeney et al. In 2015 with the external fixators removed at the 41 day. Lameness with the swelling is common with the fracture fixation. ESF is a better technique of choice as well as the splinting, according to the McCoby in 1992. Splinting has been found to be appropriate treatment for the fracture fixation in birds, specifically the tibiotarsus. The splinting have the low side effects, proper healing, normal callus formation, and it needs less instruments than the ESF. In the ESF technique, there is a minimal callus, which there is a significant difference between the two groups, which the same results are also credited by the Rao et al. At the 2016 and Vertex at the 2018. The bone union occurred in the birds for the tibiotarsus fracture after the 6 weeks of the surgery, and the fracture was completely healed according to the Stauber at the 21 day post-operatively. So conclusion, the both techniques, external skeletal fixation technique and the splinting technique, are easy, safe and effective method. But comparatively, ESF, which is external skeletal fixation technique, is better than splinting technique with respect to the lameness, inflammation and the callus formation, which are basically our parameters. Post-operative care with the use of necessary medicine, rest, balanced diet, and of course the physiotherapy, which is most important for the fracture in the birds. So on the larger scale, it's suggested in terms of fixation choices. Next, thank you.
This presentation, I still want to know that why the inflammation persisted in the external fixation, that matter, because just disappointing.
Yes sir. Sir, basically according to the one article, they are saying if the fracture is moving, if the bone is moving, because in the splinting we cannot fix the all forces, which you told us already, like we cannot fix all the forces in the splinting, like there is a rotational force which we cannot cover. So there is a little movement in the fracture fragment, it can cause the inflammation.
Can we use this method in our basic?
Yes sir. Sir, in the UAE there are a lot of avian practitioners, they are using the same method along with the laser therapy and the plasma gold therapy. They are using excessively, like sir, 3 weeks back I attended a training of avian symposium. Sir, they show the same pattern of the external fixation. Basically sir, before I started the different techniques, but Sir Mazhar Saab, he told me just amendment in my fixation technique. So this is the same fixation technique which is just here applied before that. When I came here, I was attended the technique. He said, yeah, this is the only technique which this is more stable for the wild animals also. But the technique which I used before that, which I showed to the sir also, this is not applicable here also, because I show this picture into one of the very senior avian surgeon here. He's from the Brazil. He said this is the very ideal technique which we are using in the falcons, hawks, in the birds, and we have training. I have pictures of the training also.
Okay. Will you give some suggestion for the future research?
Yes, sir. Sir, yes, sir. Sir, in the bird orthopedics, there are the very minimum instruments which we are using, which we can use, and we can treat all the fractures. In the Pakistan, sir, after taking this research, I treated many parrots, pigeons also for the with this fracture also. Sir, this instrument, this technique needs less instruments, and through which we can do a better surgery as compared to the conventional method, and which take prolonged time.
Okay. Well, if the fracture is very close to distal or proximal extremity, and you can introduce a pin in that, then what will you do?
Sir, in the distal fracture, if the fracture is going to the distal, specifically for the tibiotarsus bone, there are the less muscle and the less blood supply. There are the less healing. So in this case, we can fix with the splinting, or sometimes we can do with the. There is another technique which we call the external hybrid fixation. In this technique, we use the IM pin retrogradely, normogradely into the tibia, and just pass the pin from the proximal condyle of the tibial crest, and just pass the pin and make twist. This pin is just going like parallel to the other bone. I will show you picture if I can show. This is another technique through which we can fix the fracture with the internal fixation, and this internal fixation is fixed by another bar, like the same bar which we are using in the ESM. This is the same bar through which we can connect. This is
the question is not clear to you. The overall concern is if the fracture is proximal, close to the joint, or distal, close to the joint. Can you use this method for the fixation of the
no, sir. No, sir.
So it means you can use this device only for the mid shaft.
Yes, sir. Sir, yes.
Or if the fracture fragment is quite big, to accommodate at least one pin.
Yes.
Yes, sir. There will be a fulcrum formation, which you told me in the first day when I meet you. The fulcrum formation, if the pin are less, at least there are the 2 or the 1 pin above or below the fracture site is must for this fracture fixation. If we cannot fix the 1 pin below the fracture site, then we cannot definitely do.
Well, if it is a very proximal fracture of the tarsal, just near the extremity, can we fix a pin in the distal femur?
Sir, if we fix the femur fracture, then the joint may be stabilized.
It's not the femur fracture.
No, sorry, the tibial fracture. When we fix the joint,
Definitely, you will fix it, right?
Fix the joint but when the fracture you can do the physical.
So it can go.
Sorry, sir.
It is also sometimes done in the human beings. That if the fracture is not very big, so they just introduce the pin in the lumbar bone, and then after that you go through the physiotherapy. Just try that also.
Yeah, okay, sure, sir.
Do you recognize me?
Sorry.
Do you know me?
So yes, sir. This is the method which not specifically for the birds.
No, do you know me? I'm asking the questions. Who am I?
I think he cannot get the question.
So, what's the question?
I think
I am asking the question to you. Do you know who am I? क्या आप लोग मुझे पहचान रहे हैं कि मैं जो सवाल कौन हूँ मैं?
मेरे को नहीं पता।
Sir,
बस आगे होंगे, बस आगे होंगे। ये पीछे होता है सर। नहीं, उसको
पता चला है मैं कौन हूँ?
जी सर मैंने पहचाना है सर आपको।
कोई नाम लो।
सर मजर साहब।
And this is your luck. Today he is here.
सर आप तो मेरे मेंटोर हैं।
Okay, I would like to ask one question. What about the infection? You know, when you move through the skin and then you enter into the bone, I think there are a lot of chances of infection from the outer skin.
Sir, for the infection, like if we are talking about the ESF, we don't give the incision to the muscle. We just pass the in all.
I know. But the microorganism, they can enter through the hole easily because you are moving through the skin then into the bone. So I think the space is open for the entry of the microorganism.
Yes, sir, you are absolutely right. So this purpose we are just cleaning with the antiseptic solution and also with cover with the antibiotics with the enrofloxacin with the 10 mg per kg along with the checking the inflammation and the infection sign over there.
Okay, it's okay now.
Thank you so much, sir.
Very good presentation. But you should know the anatomy as well, I think.
And you are a good dancer also, I know.
Yes. Think the next. Okay.